post exposure prophylaxis regimens la nama povom. Post exposure prophylaxis la வந்து first thing is wound toileting 15 minutes wound treatment வந்து 15 minutes at least வந்து you have to show it under running water. So இந்த மாதிரி so running waterல வந்து எதுக்கு நம்ம ஷோ பண்றோம் அப்படினா வந்து mainly for mechanical removal of the virus from the wound and wash with soap and water antiseptic. ரொம்ப லபைலான வைரஸ் if you because it can remain in the wound and replicate in the wound for at least 24 hours as எவ்வளவு லேட்டா வந்தாலுமே you have to wash the wound and treat it with soap and water. Okay, because for inactivating the virus and for mechanical removal of the virus from the wound you have to give a tetanus toxoid prophylaxis கொடுக்கணும். Do not touch the wound with bare hands. Do not apply irritants like these betel leaves, chalk, herbs, oil, lime, chilies, soil இதெல்லாம் வந்து இது பண்ணக்கூடாது. So washing of the wounds is a priority. Okay, next. Suturing, minimal suturing should be done in case if it is required after allowing for sufficient diffusion of the RAG. So suturing should be delayed, okay, for several hours to allow the diffusion of the RAG, அதாவது rabies immunoglobulin. அதுக்கப்புறம் minimal suturing நம்ம பண்ணிக்கலாம். Okay. So எங்க இருந்தாலுமே tips of the toes, fingers, earlobes, external genitalia எல்லாத்துலயுமே safely you can inject the rabies immunoglobulin provided you do it with sufficient don't do it with overpressure because it can cause compression syndrome. Tetanus toxoid should be given. Okay, indications வந்து பார்த்தனா all category 3 patients, category 2 with immunocompromised state and all the wild animal bites. So you give equine rabies, இது வந்து horse வந்து derived, அதனால வந்து it doesn't mean you have to do a test because test பண்ணாலும் நெகட்டிவா வரும், but anaphylaxis can set in at any stage of administration of the vaccine. So the physician has to be prepared to treat the anaphylaxis himself. And human is there. So what is the dosage? Dosage வந்து பார்த்தனா the maximum dosage for equine is 40 international units per kg body weight. For human rabies immunoglobulin is 20 international units per kg body weight. Storage temperature is 25 to 30 degrees Celsius is storage temperature. And after giving the first vaccine within 7 days you have to give the immunoglobulin for the category 3 patients. After 7 days there is no use giving the immunoglobulin. Only once it is enough. Okay, you should never give it IV. No giving it IV, only infiltration. Okay, and never giving it IV. No giving it IV, only infiltration. Okay, within 7 days. Okay, within 7 days, not more than 7 days after the first vaccination it won't work. 25 to 30 degrees Celsius. So HRIG 20 international units per kg body weight and IRAG is 40 international units per kg body weight. So you have to infiltrate in the wound site, something like this. Infiltrate in the wound site as much as possible. You have to infiltrate in the wound site like this, okay, as much as possible. Remaining one the closest to the wound site one you can infiltrate.